Hi everyone, thank you for being here again. Welcome to the next episode of Columbia Asia's Facebook Live Doctors Go Live. Okay, today we shall be talking about the importance of vaccines. Okay, as we discuss this, we would like to get on board Miss Shamini Selvarajoo, who is the assistant pharmacist of Columbia Asia Hospital Setapak. Hello, Miss Shamini.
Hello.
Okay, yeah. For a while there, I thought we lost you because I couldn't hear your sound. Okay, this is all good. Okay, so we can just get right down to it. Let's talk about vaccinations today. You will be talking about the importance of vaccinations, right?
Yes, it is.
Okay, so let's start off with the general question of vaccination. Maybe you can explain what exactly is vaccination.
Sure, that's okay.
Hello?
Just
Hello?
check it.
Yeah, can you hear me?
Yes,
Okay,
okay.
let's talk about what vaccination is first and foremost, just so we can set the tone of the interview.
Okay,
What
sure.
is vaccination?
Okay. So, from what we have said here, the importance of vaccination. Vaccine is actually a injection given by injection or by orally. It is a simple, safe protection, effective way of protecting our body from the foreign substance or else pathogens, viral or bacterial pathogens. So it is
Okay.
actually uses your body immune system to build up resistance and also make the immune system stronger. So that is the main function of a vaccine to our body, and it is actually train your immune system to create antibodies to against the pathogens. So yeah, it is mainly about early protection. Vaccines are the early protection to protect our body from the
Right.
foreign materials. Yes.
Okay. I think you need to speak a bit louder because it's not so clear. Sorry, can we go to the previous slide, please? That part where you were mentioning about okay, a vaccine uses your body's immune system to build resistance
Yes.
and
Yes.
make your immune system stronger, because I think like some people think vaccine is like a medicine lah, a medication whereby you take and then you become sort of
Yeah.
superhero, that you cannot get that particular disease because you've already taken a medicine that avoids you from getting that disease. So actually, that's not what it is. It's actually something that builds your body immunity in
Yeah.
order for your body to fight off the disease, right?
Exactly, Shakina.
Okay.
So,
Okay. So that's the role of the vaccine. It's about
yeah, yeah,
our immunity system, betul tak?
yeah, betul tu. So, if
Okay. All right. Yeah. Just to get that clear. Okay. And then you were mentioning about yes, also training the immune system to create antibodies. Okay, we're clear about that.
Mhm.
What does this mean? Number 4, contain, killed, or weakened form of germs didn't cause the disease, put you at risk. What does this mean actually?
Okay, this is actually it's telling that it contain vaccine is actually contain of killed or weakened form of germs, which is like bacteria or viral. It is actually a weakened form of germs now. It didn't cause the disease or put you at risk. Means that you will actually it is in inactivate form when the vaccines get injected to our body. It's in an inactivate form. So when the other pathogens like effects, I mean, let's say the diseases are attacking us at that moment, you'll get triggered and you'll actually fight against the pathogens. So that is the
You
main.
mean inside the vaccine,
It continues
um,
to kill.
it contains germs.
Yeah, correct. It's like weakened and killed form of germs, which is inactivate and so didn't cause diseases to us. It is not. It's totally safe for us.
Okay. If it's not too technical, can you explain why vaccines have germs, whether they're killed or whether they have been
That
weakened?
is the main part. Yes, actually, vaccines are contains of how to say it contains of antigens. Antigens are the weaken and kill form of viruses.
All
So it
right.
is it is like positive versus positive. It's like that. It's like how the pathogens, the good bacteria will fight against the bad bacteria. That is the main part of the killed and weakened form of pathogens. That is the function of the pathogens in the vaccines. So apart from
Okay.
that, it is also contains the adjuvants, which is like help to boost up our immune response. Okay,
What
that
is
is
pathogens again?
pathogens are like disease or infectious disease. We call it as the
Okay.
foreign bacteria. Yeah,
Like virus and bacteria, those are pathogens.
yeah, that's true.
Okay. Okay. All right. Okay. So now let's take a look at the next slide.
Okay.
Okay, so why is vaccination important?
Okay. So most of us they really don't know is like getting a vaccination is actually an early prevention. It's like how it's become early prevention is like when we get vaccination to ourselves, we are protecting ourselves, we are protecting our
Mm-hmm.
family, and we are actually protecting the community as well. It is like it's like prevents the disease to spread to other people. Okay, so it's like help to protect our future generations from the eradicating diseases like dangerous diseases. It's like when we get vaccinated, we actually avoiding the diseases to near us, right? So help to reduce the spread of diseases lah, like actually when I'm saying why vaccines are effective, because once exposed to one or more doses of vaccines, we are typically remain protected against the disease for years, decades, or even lifetime. So that's why vaccines are really effective for us. That's why we need to get the vaccination, the jab. And rather than
Mm-hmm.
treating the disease, like once the disease enters us, then only we go for the treatment and all. So, but then when we get the vaccination earlier, it means that we'll actually get early protection. It's like getting the insurance, right? So normally we get insurance earlier so that we can actually save our money, save our lives, and like everything is there. We already will do early prevention. So that is how we
Prevention lah, yeah.
there is some early prevention. Yes.
I see. Okay, here you say that vaccination helps to protect our future generations
Yeah.
from eradicating diseases. That means there will be diseases that will not be existing anymore because I mean most people would have been vaccinated already.
Mm-hmm.
What kind of diseases are those?
There are many kind of diseases. Means, for example, like malaria, or else
Okay.
typhoid and like chicken pox and
Mm.
measles and so many other viral infection which can causes some severe effects to us, even deaths. So that's why we need to get early protection. Like vaccines, not any bacterial, it actually help in the prevention of viral infections.
So
That's
those
what
are
I'm.
existing diseases, kan?
It is. It is. It is.
Okay, but have there been any diseases that have been eradicated totally because of vaccination?
Come again?
Perhaps in certain countries where all communities that have been
Uh-huh.
vaccinated, has there
Uh-huh.
been any disease that is no longer existing because of vaccination?
Uh,
Maybe certain diseases yang right now we hardly hear about it, like polio. When people
yeah,
talk about polio nowadays, you hardly hear anything about polio because there have been vaccinations done, right?
correct, correct, correct.
Okay, so maybe that is an example of a disease
Yeah,
that is leaving us lah, something like that. Do you know what I mean?
correct. Yeah, I understand. It seems like
Yeah.
most of the infection is actually there. It's already there. It is nothing like it is like inactivate, and we don't know when we're going to get that. And sometimes, like for example, like cervical cancer. Cervical cancer, it is like highly how to say, it's like highly spreading nowadays. And like cholera, fever, like polio, as you said, polio is like inactivate agent, and it's when that particular time or moment it will actually get spread. We don't know when will happen.
Okay, all right. So just because you hardly hear anything about it due to
Yeah, yeah.
vaccination,
Doesn't mean
it doesn't
vaccine.
mean that it's gone totally lah. We still have to protect ourselves lah with these
Yeah, correct,
vaccinations.
correct.
Ada lagi ke polio vaccination? That's one of the compulsory ones, right?
Yes, HIV. Yeah, ada lagi polio vaccines.
Okay.
Ha.
Okay. All right. Okay, come. Let's take a look at the next slide.
Okay, can.
Okay. Are vaccinations safe?
It is obviously it is very safe. Like how people say, it's like, prevention is better than cure. So it is better to get early prevention rather than taking it like we are actually must take it in the early stage, and also can prevent unwanted diseases like it's like attacking us, like unknowingly we get in contact with the bacterial or viral infection from anyone everywhere. Hence, getting a vaccine is early prevention. I mean that what I'm trying to say is like prevention is better than cure. So it is obviously
Yes.
safe.
Okay. What are actually the concerns? What would make some people think that vaccinations are unsafe?
Uh,
Why is
okay.
it that we have to tell people, okay, vaccinations are safe? have there been questions? Sorry,
Okay. It is
have there been questions about vaccinations that that make them think that a bit wary, a bit cautious of
right.
getting
So like,
vaccinations? What's the worry here? Okay, that you usually get. I'm sure you get questions from some people who know
right.
that you are a pharmacist
Mm-hmm.
about vaccinations. What are their concerns?
Okay.
That's my question actually. What are their concerns?
Okay, I got it. And it's just like
Mm,
some people, not to say that they didn't find it unsafe, but just that
mm,
what is the important? Why do they need to get a vaccine and all? It is like for me,
mm,
it is like varies from the opinions, from the opinion accordingly. Some people saying that it is not really important. I'm very safe. I'm very healthy. But then why do I need to get the vaccination? It is not like
mm,
you
mm.
don't know when what will happen to the next day. What will attack
Yeah.
us, how we're going to be in the future. Like
Yes. Yes.
currently we are actually suffering of this pandemic issue, right? Like Corona 19.
Mm, yeah.
Uh, Whoever get a early prevention, like getting a vaccine, doesn't mean that I didn't say that getting a vaccine will prevent from the corona. No, just that it will
Yeah.
prevent you from the other infection. It is totally safe, and people, their mentality of getting it, like they didn't take it as a serious note. I mean, they should take it as,
Mm, mm,
it is not to say that it is unsafe. It is very safe, and people are thinking that it is not important.
mm.
It's not important.
Okay.
That is their concern. As I know, as I heard it from the people outside, they're saying that why do I need to get the vaccine? What is it so important? It is,
Yes.
yeah, it is quite important. It is very important, obviously.
Yeah. Like you mentioned, I mean, if it has not happened, and then people will feel that they are
Yeah,
okay. There's nothing that can happen to them until it happens, lah. So this
exactly.
is like you said just now. Prevention is better than cure. Yeah.
Right,
Okay.
correct.
Come. Let's take a look at the next slide. What diseases do vaccine prevent? Okay, I was going to ask you something about this. The diseases are not necessarily diseases that can infect other people,
Okay.
right?
Correct, correct.
Okay.
It may
Okay,
occur.
maybe we'll just go through the list of diseases.
Yeah, correct. As I showed here, which is actually what are the diseases do vaccine prevents? It's like cervical cancer. We have already talked about it in the previous sessions, like
Yeah.
cholera, fever, and hepatitis B, influenza, tetanus, typhoid. All those infections are actually not to say infection. Okay, let us just talk about the tetanus. Yeah. So
Okay.
let's say they accidentally fall down,
Mm.
and
Mm.
from the soil we don't know what is in the soil actually, so it
Mm.
is not spread out from the other people, it is from the soil itself. It is like the nature
Yep.
of, so it contains some virus, sorry, bacteria, which can really causes infection to yourself. That's why this tetanus injection, it helps to prevent, it is like a early prevention. It will never cause any, I mean, that particular bacteria to trigger or it enters in your
Mm.
body. It's like stop immediately.
Mm.
Uh,
Okay. 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 All right. Do you want to go through the others as well?
um,
Pneumonia, rabies, tetanus. And all. Okay, this one, are these all compulsory vaccinations in Malaysia?
it is, miss. It is actually.
All of this?
No, not really. Not to say all
Oh,
of
not
it.
all
Like,
lah. Some are optional.
yeah, some are optional. There are.
Okay, which ones are the compulsory ones
Okay, I'll say that.
from this
So,
list?
HPV is one of the compulsory vaccine we should get for the girls, women above 13 years old. They should get this. This is compulsory for them. And the cholera
Right?
vaccine is
They
okay. It
get
is,
the vaccination in school, right?
yeah, correct.
Okay, all
And
right. Yeah.
diphtheria is
Mm.
like we call diphtheria, pertussis, and also typhoid. This three is actually a combination which is one of the important vaccine which should get it in a three doses. It is
Okay. Okay.
compulsory. And
Three in
hepatitis
one
B,
lah.
yes, it is three in one, ma'am.
Okay. All
Last
right.
time it is
Yeah.
only a single dose. Now it's in a combination. Okay.
All
And
right.
hepatitis B, it is very important and it's compulsory as well as for the liver, which the babies
Mm.
should get it during the born. I mean, the newborn babies, they'll go for the BCG and also the hepatitis B as well. Also a
Okay.
compulsory.
BCG is to prevent what?
BCG is actually to prevent, to protect the lungs and also from the pneumonia itself. So it is very I mean, it is very
Mm.
important for the newborn baby for the early stage. Why? Because the newborns are
Mm.
actually, they have just born and the immune system is not fully developed, and
Mm.
higher chance of them to get or to get the effect, I mean, to get
Yeah.
uh, diseases. It's like they easily
Right,
can
right.
get diseases. So
Yeah.
that's why.
BCG is the one that's most obvious lah, because that one, everybody in Malaysia,
Yeah,
registered patients definitely will have a mark lah on
exactly.
the arm. Left or right side or any side also can.
So it is actually, I think it's on the left or right. It's either one.
Left or right, I see. Okay.
Yeah, it is
Okay.
actually the first dose. It is compulsory and it's very important.
I see. Yes, that's the first injection that all babies get, right?
Correct,
At
correct.
birth, is it at birth?
Yes, miss. It is actually it is very important for the newborn babies.
Okay. Okay. All right. So that's BCG. What
Correct.
about influenza, Japanese encephalitis? Are these compulsory or optional?
Okay, the Japanese encephalitis is actually for mostly it is available in Sarawak, and it is actually for the Sarawakian people lah, I would say. And
Mm.
influenza, it is up to the individuals. It's like if they wanted to
Mm.
get a prevention from the flu or fever or during that time, so it is the
Yeah.
option. It is up to the patients. Yeah. And even for
Okay.
chickenpox, it's also optional. And
Mm.
meningococcal, which is for during the traveling time, if they wanted to protect
Mm.
themselves, let's say they are from Malaysia,
Yes.
we travel to the other country, so we need that
Mm.
meningococcal injection as well. So it's all like optional.
Yes.
Pneumococcal, meningococcal, chickenpox like varicella, hepatitis A,
Mm.
it's all optional. It's like
Okay.
depends on the individual. If they wanted to, they can actually go for the vaccination.
Okay. Can I ask you something? Why I mean, if vaccines are important, all vaccines are important. Why is that some vaccines are optional and some vaccines are compulsory?
Okay, for this
Or is
question,
that more like a government ruling ataupun that's more, I mean, is
not
there a scientific justification for that?
okay. So for this, it is actually I'll just mention you few optional vaccines here, like
Yeah.
rotavirus, like Prevena, that what we are having here right now, pneumococcal for the Prevena,
Yes.
hepatitis A for the chickenpox, varicella or varicella,
Mm.
meningococcal or Tdap. It is actually a booster dose. It is to
Right, I
boost
see.
your immune system to protect against those pathogens.
Mm.
That's it.
Yeah.
And that's why it is actually in optional form, ma'am. It is not really compulsory.
I see. Okay, okay, all right. So, okay, we're done with that. So now we know about the diseases that have vaccines. When do we get vaccinated? Okay, just now we mentioned about
Yeah.
cervical cancer vaccinations are done when girls are in Form 1.
Above
Is that
13
right?
years. Sorry, come again?
Form 1 kan 13 years. Okay, okay, all
Yeah,
right.
above
Then,
13 years.
okay. What about the other vaccination? Okay, this one I will just leave for you to explain lah.
Okay then. So when to get vaccinated is actually
Yeah.
from the birth itself. Uh, from as I explained to you all earlier, it is like the young age. The kids or pigs are really prone to get effect by the pathogens because their immune system is not really developed, and
Okay.
also
Okay.
body is less able
Mm.
to fight against the bacteria. So the early
Mm.
stage, both stage is really important. Childhood, teenage, and also the old age people. So,
Mm.
these are the main stages they have to get vaccinated. And I would actually remind the parents it's their responsibility to give to get the proper vaccination schedule for their kids for their early protections. And it is actually they will have a vaccination card to provide at the hospital, which is provided at the hospital. They have to get through it, and so they have to equal timing there so that we can actually get the vaccination in a proper time for at their ages. Okay. And
Okay. Okay.
it's actually showed there as like as per scheduled by Minister of Health on compulsory
Yeah.
vaccination. There is actually a schedule which is uh, given by the Ministry of Health, saying
Mm.
that these are the compulsory vaccinations which should
Yeah.
taken by the kids or above, like what are the stages they should go for.
Okay, so the compulsory ones, there is a card lah where you can actually see the schedule, so you know whether this child has been vaccinated against certain
Correct.
diseases or not.
Correct.
But let's say, for example, if for optional vaccinations, you can't remember whether you have had this vaccination before or not. So like, hepatitis A or B, or I'm sure that happens. Can you
Yeah.
go to the doctor and get vaccinated again, or is that dangerous? That means you must be really sure that you have or have not had that vaccination
Okay.
before you sign up for another one.
This is like normally from the experience from here lah.
Ya,
Normally,
takut nanti double dua kali
exactly.
pula kan vaccination.
Exactly, but so normally the physician they will actually let us know, and it
Mm.
is like our own responsibility to know what are we getting. It is like our kita punya principle, like let's say
Yes,
sekarang kita
of
dapat
course, yeah.
and let's say kita dapat one vaccination, is that we need to know. Let's say there is 3 doses for that particular.
Mm.
Let's say for
Yes.
example Prevena.
Mm.
Prevena has 3 doses, so we need to
Yeah.
know when we get the first dose and how many remaining doses are there. It is our own
Mm.
responsibility. So if, for example, like they can, macam biasa, they can have the vaccination card with them, so
Mm.
that they
Mm.
still reminding themselves there's 2 more doses and there's 1 more doses for them to get.
Okay, yeah. But memang is their responsibility, and memang they have to have that card lah. But I mean, human being humans,
Correct,
sometimes
correct.
they tend to forget, sometimes they tend to leave their card behind and things like that. Okay, would your advice as a pharmacist for that person to just go ahead and get that vaccination that he or she has forgotten lah, whether they have had that in the past or not,
Okay.
or don't take that chance?
Okay. So,
You know what I mean kan? Macam
correct.
suddenly I want to go, I see a doctor and I want to get vaccinated, but I'm not sure. Maybe I have had this vaccination before. So if you are unsure, don't take the vaccination.
Yeah, that's true. It is
I'm not
actually
saying that. I'm just asking you whether what would be your opinion on
okay.
that?
My opinion is it's about if let's say
Mm.
uh, they didn't know that they are not really sure that they have taken this vaccine or not, it is better for them to go back to the earliest. I mean, yeah, it is like let me think first. Okay.
Come back to that question, but I hope I'm not putting you in a spot here, but I'm just saying that because we tend to be forgetful sometimes, but it is really about whether it is safe for someone to get vaccinated. Tapi memanglah double vaccination, I suppose
Exactly.
that's
And so,
dangerous.
okay. I mean, the
So
okay.
okay. Based on that question, is there any way for the doctor or the hospital to find out whether we have been vaccinated for certain things or not? Because okay, let's say I'm not sure whether I've been vaccinated or not. So can you do like a blood test or any kind of test to know, okay, Sakina, you have been vaccinated for this and this?
No, I don't know. Not really. No.
Oh, I see. So there is no test to know
Yeah.
whether you have been vaccinated against
Correct.
particular diseases. So you have to
Exactly.
know yourself lah.
Exactly. It's
Okay, that
actually
means it's very dangerous. Just
it is.
write down everything.
Yeah, vaccination is
Mm.
one of the most important kind of. It's very one of the most important thing. So we need to know and we need to remember about what are the vaccines that we are getting. It is better to get
Mm.
a card or just write it there. So when the doctors ask us for a second dose, let's say you already take this before or you have been on this before,
Yeah.
so
Yeah.
it is easier for us to have a card. Yeah, I know humans are
Definitely, yes. Of course, you have to depend on the card. So there's no two ways around this. You have to have the card, or you just have to write down somewhere that you have had
exactly. So
whatever
we need to
vaccinations lah that you
exactly
had, right?
correct, correct.
Okay. All right. So let's move on. Let's see what is the next slide.
Yes.
Who can get vaccinated? Okay, today we're not just talking about vaccinations for children, right? We are also talking about vaccinations for adults. Is there
Yes.
an age limit?
Okay, means it is there is no age limit for this. It's actually anyone can get the vaccination. It's actually from the beginning, from the birth to until
Mhm.
the old age, about above 65. Above
Okay,
60. Okay. So anyone can get the vaccination
I see.
except there is actually except people with the chronic diseases. Why? Because people with the chronic diseases can't go for
Mm,
vaccinations because
mm,
their immune
mm,
system is not responding. When
mm,
their immune system is not deep or effective, that's
yeah.
where the chronic diseases may. that. So when the vaccination is actually in conjugate with the immune system, so
Yep.
when they already have the chronic, able to do so. So that's why they can't get
Mm.
the vaccination. And those who are having allergy reaction for the adjuvants or the contents of the vaccines, they are unable to
Okay.
get the vaccination as well. And
Okay.
infected with flu or fever, those who are
Mm.
infected with flu or fever, let's say, as I told, it's like prevention, early prevention.
Mm.
So
Yes.
whenever you already have the flu or fever at this stage, and at that time
Mm.
you can go and get the vaccination because your immune system is already releasing
Yeah.
some something to fight against. That's why I
Mm.
mean,
Mm.
like
Right.
you won't act immediately. So yeah.
Okay. So if you are infected with flu or fever, you have to wait until you're well and then come back.
Mm-hmm.
Yeah. Okay. All right.
Yeah,
So unless it's a chronic disease, then you memang cannot
yeah, yeah.
get vaccinated at all lah. Okay. All right. Clear. Clear on that. Okay. What's next?
Okay, our next slide will be okay, like as I
Yikes.
told
Okay.
you earlier, it's like a
Okay.
compulsory vaccination by the Ministry of Health, Malaysia.
Yeah. That's a long list.
It is, it is. So this is the list that I told you just now. Every parent they should know. I mean, like not to say every parents, every individual they should know about this vaccination, the importance of vaccination,
Okay.
and what are the vaccine they need to administer to them. So these are the
Okay.
list.
Okay.
Yeah.
All right. Do you want to take us through this, or is this something that we've covered already just now?
Uh, we already covered this, but then
Covered
still,
this, ah? Okay.
yeah, yeah.
Okay, all right. So there's newborn, 1 month, 2 months, 3 months, 12 months. Wow. And then what happens after 12 months? When is the next vaccination?
It is
After
actually
the
uh,
oh, there's more.
yeah.
Okay, all
There's
right.
more.
I thought that was it. There's
There are
more.
many.
18
Yeah.
months, 4 years, 7 years, 13 years. What
Until
vaccination is at 15 years?
15 years is actually the TT vaccines like tetanus is. It is actually for protection. After 13 years, as I told you earlier, there is a HPV vaccine, right? Above 13
Correct,
years old.
yeah.
If 15 years
Mm.
old, we can still use that human papilloma virus HPV vaccine
Mm. Mm,
for
yeah.
adults. And
Okay.
it's already shown there about the optional vaccines down there
Right.
about pneumococcal up to 2 years, I mean up to 2 months, and influenza up to 6 months, rotavirus,
Mm.
it's actually from 6 weeks to 6 months, hepatitis
Okay.
A from 10
Okay.
months and above, chicken pox,
Okay.
it is like optional, just up to
Yeah.
us if you really
Yeah.
want it.
All right. Okay. Now let's take a look at what's next. Thank you.
Okay.
Okay, but we have a long list of questions here. Well, thank you. That was very informative. And we have had like quite a few questions branching from questions. Let's
Okay.
take a look at, okay, questions from our viewers, beginning with Mr. Dean Dali's question. Do vaccines cause autism? Oh, yes, this is one of the controversies that people are talking about.
Vaccine cause of
Sorry.
autism.
Yeah. Yeah. Okay.
Okay, it is not really, I mean, no.
Yeah, it's okay. You don't have to address this because if it doesn't have anything to do with
Yeah,
vaccinations proper, then it's
yeah.
okay. We can skip this question. Okay, all right. Let's go to Encik Zai's question. Hi, Columbia Asia. I have a few questions. Number one, can getting so many vaccines at one time harm my kids? Okay, what do you think about that? We just address this one by one first lah.
Okay.
Mm,
You getting so many vaccines at one time. How many kids?
mm,
Okay, this is actually there is an option there. Means there are
mm.
few vaccines which is like separately
Yeah.
given. So a
Mm-hmm.
combination, as I mentioned earlier, there is a
Yeah.
combination. Hey, I mean
Right.
TDAP, which is actually combines is a combination of three vaccines, which is
Mm,
pertussis, diphtheria, and also tetanus.
mm,
Three
mm,
is
mm.
actually a
Yeah.
combination available in the name of booster. So that's why we can actually
Right.
inform the doctor so that they will give a combination and reduce I mean, it's like the baby is okay, still can away from that scaredness, like, because getting so many injections, right? So yeah,
Okay.
it's like the option is like getting a combination vaccine.
Okay. Okay. All right.
Mm.
And the second question is, why do some vaccinations require boosters?
Oh, it is because it just to remind boost our immune system. At a
Mm,
point of time, the effectiveness should go lower. So that's why we need to get a booster dose. It's like for example, like let me just take the Prevena or Hep B. Hep B, you need to get 3 doses. The first dose
Mm.
lasts first month, and then the second month, and go for after not I mean after selang semonths dekat situ. So it's like getting booster dose because of the effectiveness will get lower.
Okay, all right. Finally, from Encik Zai, it is reported in a researcher's website that there's a risk at repeating influenza vaccines. Is it true? Okay, I don't know what this is about really. Why do you need to repeat influenza vaccine? Is this because of the, is this a booster?
Oh yeah, we could call it as a booster dose. Why? Because
Okay, all right, I see. So
influenza
what,
is
what is the risk here?
okay. Uh, I didn't find any risk over here. It's just like 6 months.
Mm.
The influenza booster dose is actually getting. It's like optional, just up to the patients. If they really wanted to protect from, let's say, some patients may fall sick, like so oftenly they can fall sick. So that's why this influenza help them to prevent from the sickness, like flu or fever. So it's like every 6 months. No need to get like frequently. It's like every 6 months once. So just up to them.
Right.
It didn't cause any risk over there.
Okay. All right. There's one more question here from, I mean, there are a few more, but this is from Miss Cecilia Chong. Can we still get the disease even after being vaccinated?
Okay, so it's a good question actually.
Has that happened before?
No, not really. It is like it's a early prevention. No, it won't cause any. I mean, like the disease won't come back again. I would say, and
Yeah.
slightly some rare side effects. I mean, like a common side effect. So
Mm.
people might think it is actually because of this vaccination. No, it is just a common side effect like getting a flu or
Yeah.
fever or a mild like I mean arm sores or pain
Right.
or rash just
Mm.
because of that vaccine like administered at the first
Okay.
like a common rare side effects. That's all. But I don't think it's actually
Mm.
covered. We are actually vaccinating just to avoid or to prevent from the disease, so
Mm.
never happen again.
Okay, okay. All right. Next question. Oh, I think this is a comment from Miss Paramaswari Kandasamy. Indeed, clarification. I suppose this means that you had been clear lah with your explanation. So thank you for those.
Thank you.
Zulfarhana Muhammad Zain is asking, what is the difference between northern and southern flu vaccine?
Okay.
I think, yeah, you need to explain this one. What is northern and southern flu vaccine?
It depends. Okay, northern and southern flu vaccine.
What is that?
Let me think. Give me some time. Yeah.
Is
So
this about areas?
I
It is
think it's
about flu in Perlis and Kedah or flu in Johor, or it's nothing to do with geography.
northern and southern is like how we actually it's like for example I think I can take this Japanese sorry Japanese encephalitis for Sarawakian.
Mm.
Some people
Mm.
the weather maybe and also
Okay.
yeah, it's actually the weather. Probably it's just because of the weather. And
Oh, the weather. Okay. Okay. All right.
okay, that's only Japanese. I mean, like Japanese encephalitis for Sarawakian. Why is it like just for the Sarawakian? Because maybe at that country, this particular
Mm.
virus is actually higher. So
I see. Okay.
just because of that, I think that's the thing that Zulfarhan is asking. Northern and southern flu vaccine.
Okay.
How?
Okay. So it is about geographical factors lah. Right? Okay. Hi, Mr. Bajish. Mr. Bajish was with us every episode. Okay, next one is Muhammad Divan Chong Fernandez is asking, do we need to get vaccinated monthly or yearly to get protected?
Okay, like as I told earlier,
Hmm.
so it is actually for the optional. They already have some schedules there. So it is like optional vaccines, for example, like Prevena. We can
Yeah.
actually there is 3 doses for that. So
Okay.
we just show a simple table there. So it
Okay.
is better if like optional, they'll still have some doses like booster doses to get after 6 months or even after 2 months is just like booster doses lah.
Okay.
If in case
Yes.
of yearly, I mean like if like influenza vaccines, yes, it is yearly. I mean like every 6 months. It's just like
I
2 doses, which is
Okay.
must take every 6 months. And
Okay.
there are some vaccines like the compulsory vaccines. Yes, they should take it like monthly basis. It is. I think
Okay.
I still have some a little clarification just to show to the people so that they can understand.
Can. Yeah, go ahead. Yeah.
Okay, this is actually a table.
Oh, that's very
Yeah.
small. I don't think we can read it, but maybe you can explain it. Lah.
Okay,
Mm.
so please explain from here, like the vaccine, for example, like how the previous patient asked just now, is
Mm.
it in a
Yeah.
monthly basis? Yes, it is. Like BCG, we must get it from the birth itself, and
Yeah.
after 6 to 7 years old, like, if let's say there is
Okay.
no scars there, they
Yeah.
can still go for the BCG. And hepatitis
Mm.
B is for the liver, and still for the
Mm.
baby as well, they should get 3 doses, like
Okay.
monthly doses, which means like from the
Mm.
birth
Mm-hmm.
first month and also in a 6 month they should get it like
I see.
they should follow it. So
Yeah.
yeah.
Okay. Okay. All right. Okay. So that's all the questions that we have. So do you have anything else to say about vaccinations? Maybe tips or advice
Yes. So yeah,
before we wrap up the show?
wanted to say a few things. It's like giving a little friendly advice to the patients out there. So most of us like thinking vaccination is not really important, and they are actually taking it in. They didn't take it as a serious note. Vaccines are really very important. Why? Because to protect ourselves uh, from the pathogens out there. It's like viral or bacterial. Didn't say that yes, we already have our immune system. Just in order to boost our immune system to fight against the pathogens, we need to get the vaccination. So people out there, just kindly get your vaccination done and don't delay. You may, in order to get more information about the vaccines, you can actually call anytime. You can call us anytime. So then we can actually provide you a proper information about the vaccine. And the doctors here are really friendly and they can actually guide you throughout. All the specialists, they are ready to help you. And do not don't put it in another way. Just think it in a
Mm.
positive way so that vaccines really help you, saves your life, and get vaccinated and be safe and healthy out there. That's all about it. Thank you.
Thank you, Ms. Shamini. Well, actually, one question just came in. If you don't mind addressing it, this is from Ms. Usha Panir Selvam.
Yes.
Can a person who is allergic to eggs take vaccine shots? What do you think?
No, I don't think so because vaccines, whoever allergic to eggs, they should not take the vaccine because it contains the eggs inside.
I see. Okay. Okay. All right. So with that question, we can end the show. It has been very exciting. Great topic. A common
Yeah,
topic, I must say, but then great insights and content.
yeah.
So thank you, Ms. Shamini Selvarajoo, Assistant Pharmacist from Columbia Asia Hospital, Setapak.
Thank you so much.
This has been Doctors Go Live on Columbia Asia Facebook. We will see you again with another exciting topic soon.
Yeah, thank
Thank
you so
you.
much. Thanks a
Bye.
lot. Bye. Take care.